having me.
It's been an absolute pleasure. So, as I said, you have been very open and honest and brave about your mental health problems. Do you mind telling us if you're aware of any specific events that you think have impacted you more than others throughout your life?
I'm not sure about specific events. Like when I've had therapy and tried to sort of pinpoint a specific thing, there wasn't really anything. I had like a really, really good childhood, nothing that would, you know, to suggest any problems mentally from like a young age. I think it was from about the age of 13, I kind of knew like something wasn't right. I never really fitted in. I was always bullied. Like I was bullied when I went to my first dance class. I was bullied at school, bullied at college, you know, just to varying degrees.
That's very sad.
So I think maybe like because of what I went through with that and sort of subconsciously having those different coping mechanisms, it sort of made me act a certain way or think of the world in a different way.
So that's a very young age to realize that or to feel different from other people, right? At 13, that must be quite hard to cope with.
Yeah, especially when like, because I didn't know why at the time. I didn't really know what like depression was or anything like that. I just knew that I was a bit different or like felt different, and people saw me differently as well. Okay.
And you mentioned coping mechanisms. Do you mind telling us a bit about which mechanisms you'd use when you were younger?
I definitely started to, what's the word? Like there was things when I was in high school, people would say that I was ugly and they'd shout things to me in the corridors. And I started like being overly confident, and I'd sort of laugh with it. Like, you know, if they were coming down the corridor, I knew they were going to call me ugly. So I'd have my little makeup mirror and I'd be like, oh my God, like I'm so beautiful. You know, I just started to have a bit of an attitude.
Okay.
And I think that was how I coped, by having a bit of an attitude. And then as I grew older, people would, you know, say I was a bit cold. And I think that was just like me putting up a barrier.
So it sounds like you're almost joining in the joke so that the bullies can sort of have the joke on you first.
Yeah, I think so.
And do you mind telling us a bit about the diagnoses that you've been given throughout your life?
Yeah, so when I think I was like 18, 19, I moved to London, and I ended up like having this massive like sort of argument with my boyfriend at the time. And I ended up like, I remember him like kicking him and everything. And he was like, this is just not normal to like react like that over something so little. Yeah. And it was then that I realised, yeah, okay, that isn't normal. I don't know why, like I'm acting like that. So I went to the doctors, and they thought I had bipolar. And then other doctors have said, no, that's a red herring. Like I think it is just depression and some anger management issues, which I never really felt I needed anger management. I think it was just a mixture of everything. And yeah, I mean, if I do have bipolar, then it's high functioning, you know, like I sort of live a normal life. And then when I was pregnant with my daughter, I got diagnosed with quite severe anxiety as well, and postnatal depression once I'd had her as well.
And for people for listeners who might not be familiar, do you mind telling us a bit about postnatal depression, what it felt like and how it affected you personally?
Yeah, well, when I'd had it, I wasn't sure that I had it at the start, because I always thought postnatal depression was when mums jumped off cliffs with their kids, or, you know, like wanted to harm their children. So it never like crossed my mind until I opened up to like the health visitor about what I was feeling. And I started then researching about it and realized, oh my God, like this is so normal. I would just think to myself while she was asleep in her cot, like, what have I done? Wow. Like I've now got this child that I literally have to look after for the rest of my life. Like, what am I going to do? I'd carry her down the stairs and I'd just picture her like falling and just splattering on the floor, like all this dramatic like imagery. And just, I mean, I would never ever hurt my daughter. I always loved her throughout the whole experience, but there was definitely just like, my life's over. There's no way that I'm going to be happy again. But when she was about 9 months old, I started to really bond with her, and those feelings started to go away.
Actually, that was going to be my next question. Do you think that earlier than the 9 months, the symptoms that you were having, the emotions you're going through, do you think that interrupted your ability to bond with your daughter?
Yeah, definitely. Because like I said, there was never any regrets of having her. Like I always, as soon as she, was here, I loved her and I protected her. But it was just those feelings were sort of blocking me from being able to bond. And I had gone through a traumatic thing just before having her as well. So I think I just wasn't in the right headspace to sort of embrace the baby.
Okay. Do you mind if I ask what that was?
Yeah, so I was with my fiance at the time for about 2 years, just over 2 years, and he ended up just leaving out of nowhere when I was about 6 months pregnant. So obviously had no way of paying rent, had to obviously leave my job. My granddad was paying rent for me, and I was just stuck in this house in the middle of nowhere, 40 minutes from any family. So as you can imagine.
Yeah. Sounds
crazy.
Like a horrible mix of all these factors, right? You're young, you're on your own, having a baby in itself, even in very supported, familiar territory is really, really hard work, but it's even harder for you. Yeah.
Yeah.
So people that I've met with postnatal depression have very similar symptoms. So they're quite negative about their baby. Some people have anxieties like you did about how they're going to cope. They have negative kind of pessimistic views about the future. When it gets really bad, some people actually have thoughts about harming their baby, and sometimes it's intrusive. So they don't want to think like that. They're not intentionally thinking like that, but they can't stop themselves. So I'm happy to hear that wasn't the case for you.
Yeah.
How did you cope at the time? How did you manage to get through?
Just sort of accepting the support, really. I just had to accept the fact that my granddad was going to have to pay rent for me for a while. I was going to have to rely on, my family for my weekly shops. And, as quite an independent woman, that was the hardest thing, really. I had no other choice but to just sort of surrender to other people helping me. Yeah. But because of the support that I did have, I've got a lot of really good friends, a lot of close family. That was the reason, really, I think. And I ended up meeting someone else as well, and he's actually still with me now 4 or 5 years later. So all of those things, just focusing on those positives, definitely helped.
Did you have any professional support, for a psychiatrist or?
No, not at that point. This was about 4 or 5 years ago, so it wasn't until 2 years ago I started getting intense therapy. So I was on medication. Obviously came off those antidepressants while I was pregnant, but I went straight back on them when I had Ella. So I think that obviously helped, having that little stability of the medication.
And do you mind if I ask, the reason that you didn't seek support or you didn't get support for that long, was that because you actively didn't ask for it, or was it because it wasn't available?
I tried CBT before, through the doctor, phone therapy. And it kind of helped a little bit for my anxiety, but it didn't help at all. And I don't think I was aware that you could get really good, sort of talking therapies through your doctor. And then when I'd Googled private counsellors, they were just so expensive. So I just sort of put it off. But yeah, a few years later, I did actually get to a point where I was I'm not enjoying my life. And I just asked my parents and I said, look, I really want to work on myself. Will you pay for therapy for me? And it was them that paid for me in the end.
Okay. Yeah, I think you've hit the nail on the head. It's a big problem, isn't it, for people who are not necessarily have that much financial stability. I mean, we're talking maybe more than £100 per session, and you need, I don't know, 6 minimum sessions, maybe even more than that. So we're talking about a amount of money. And unfortunately, these kind of illnesses can impact more on people from harsher socioeconomic backgrounds, I think. So do you mind telling us a bit about your therapy and how it's helped you?
Yeah, so I went there and it was a bit awkward at first, but I just was sort of right, I'm just going to try it, not give up with it, because this could be what saves me. The lady, luckily, the first therapist I found, she was amazing. And I just felt like it was just, she was untangling. I would tell her things and she was just untangling this spider web in my head. And all those times that I've been bullied, my previous miscarriage, my breakup, just everything, I just learned why I was feeling those things. and realize actually, like, I'm not the only person that's felt this way. That's just because I've coped this way with a certain thing. And it sort of made me love myself a little bit more than what I had. I sort of hated my little, you know, mental health quirks, as you call them. But no, she definitely made me learn to love myself and be easy on myself. And that was such a massive difference in my life.
Okay. So it sounds like one of the main ways she helped you was kind of normalizing what you were feeling. So you would kind of explode with all these emotions and she would pick apart where they've come from. Is that right?
Yeah, exactly.
So there might be some of our viewers who might think they need therapy and are just a little bit uncomfortable about taking that first step. So do you mind just very briefly talking us through what they should expect, what their therapist will say to them, what they'll do, what their homework is, that kind of thing?
Yeah, so there definitely is homework. Every week they'll give you something to try and work on or try and change your thinking in a certain situation. And you just do have to do it, because if you don't, you know, you're going to be spending that money for what, if you're not going to just throw yourself into it. Some things can be a little deep. So some lessons or sessions, you might come out and feel like, I don't want to go back. That was horrible. Like, why am I letting myself be in that, you know, headspace of going back there? But it's important to, because, you know, you bury it down, obviously. And sometimes you just need to bring it up so that you can put it away in a little box. But obviously therapy is not for everybody. I don't think every single person will benefit from it. Some people don't like talking and might be really uncomfortable. Other people like me can talk for England, so it's okay.
I suppose
but yeah,
also sometimes people have trauma that they're just not ready to actually expose, and actually talking about it can make them worse for some people.
Yeah, exactly. And I was just ready. Like, I knew I was ready to do it and take that step. So.
And you've got a mental health podcast. Is making that cathartic and helpful in itself?
Oh, 100%. Yeah. It's almost like I feel now that I went through all that stuff so that I could help other people. Like, the way it's grown, the reach it's gotten is just so nice to be able to be that person that I didn't have. So like, people will message me and say, oh my God, like, I felt that exact same way when I went through that and I thought I was weird. So it's like I'm sort of being what I wanted to have.
So you're basically doing, or not exactly the same, but similar to what your therapist is doing for you. You're taking other people's experiences and explaining that it's normal and that lots of people go through similar things.
Yeah, exactly.
So actually thinking about doing a podcast and then going on to doing it and it becoming successful is a massive, massive journey. Do you mind talking us through how it's come about and how you've managed to succeed?
Yeah, so I'd wanted to do a podcast for quite a long time, and I really liked the idea of it, and I just wasn't really sure what subject I'd do it on. Had thought about the mental health aspect, but I thought, oh, people at work and stuff like that, they think I'm so weird and I'd have to go in and face them, and, you know, when they know what I've been talking about, and they'll know now, like, all my issues and stuff. But then, like, unfortunately, during lockdown, one of my fellow nurses committed suicide. And that just, it affected everybody on the ward. It was just horrendous. None of us knew she was going through such a hard time. And that, I was like, a couple of days after, it was like 12 a.m. and I just set up my podcast. Like, I just spent all night just setting it up, because I was like, no, I'm going to do it, because what if my podcast would have given her a bit of comfort, or there's someone else who's feeling lonely? And I just thought, why am I not doing something that I would really enjoy just because of what other people are thinking?
Yeah.
So yeah, just do it.
Very inspiring story, actually. And then how have your work colleagues reacted to it, would you say?
Yeah, like, and I'm so happy with them, because they all listen. They all, like, when I come into work, they say, oh, that episode was really good, and they're just so supportive. And I just think, oh my God, I could have done it years ago.
So I think there's a message there for people, isn't it? Which is that sometimes you just have to take the first step and not kind of overthink it yourself.
Yeah, 100%. You think about all these, like, famous, intelligent people, scientists, you know, they were all said to be crazy, and not comparing myself to any of them, obviously. But, you know, the first person to do something is obviously going to be thought of a little bit weird, maybe. But yeah, you just got to do it. Who cares?
And you mentioned the your colleague's tragic suicide happens, was it during the first
Yeah.
COVID restriction? Right. How's COVID affected your mental health?
It's a weird one because I feel unlucky in a certain way because I've obviously had to work at the hospital through it. So I've seen a lot of horrible things and had to sort of work through that whole thing, feeling like I was going into danger. But at the same time, at least I still had a job. At least I could still go in and socialise with all my friends and have a laugh and try and sort of work through it. So I know I was lucky in that way. But it's definitely, I'd say it's kind of changed my sense of humour a little bit. I think because we've all had to at work sort of make a joke out of things and sort of be lighthearted in bad moments just to kind of get through. And my fiance has definitely noticed that I'll be a bit like a dark sense of humour, but I think it's because I've had over the last year, like had to really do that to sort of get through. What about you?
So one of the things that you said actually really rung true with me. So I did some voluntary work for an organisation called Frontline 19, which was exactly what you're talking about. So it's to give support for people for frontline workers, for sort of nurses, doctors who were seeing all these COVID patients. And
nice.
This came out of nowhere. Nobody's prepared for it.
Yeah.
People, their roles suddenly change, sometimes without confidence or expertise, and they're dealing with people dying in front of them.
Yeah.
So it was basically to help them. It was like an extra layer of psychiatry assessment to help the ones that were self-harming or were at risk of suicide. And I had very mixed emotions about it, because on the one hand, I felt it was a good thing to do, otherwise I wouldn't have volunteered to do it. But I also felt very restricted because I didn't really have any jurisdiction. So they already had psychiatrists that were supposed to see them in the community. Some of them, well, the cases that I saw were escalated to me because their psychiatrists weren't really doing their jobs.
Yeah.
Were their mental nurses, so they weren't getting any support, they weren't getting seen, they weren't getting medication, and I couldn't actually prescribe for them because I'm not allowed to outside of my area. So the best I could do was try and contact their psychiatrist to say this person's not coping and they need more support, which is kind of potentially stepping on their toes a little bit, because I'm kind of telling them how to do their jobs. And a couple of the psychiatrists were fine and sort of said, thank you for highlighting this, and then went and did what they're supposed to do. But a couple of them just got a little bit shirty because they don't know who I am. I'm just some random guy that they've never heard of, and suddenly sending them like a formal letter on behalf of another patient. And I think psychiatrists shouldn't have enough of an ego. They should listen. But I think one or two of them just felt that I was being a bit just sort of muscling in their territory, really. So I got a little bit of pushback from that. So it was a mixed experience, definitely.
Does it affected your mental health in any way, like having that?
I think it did at the very beginning when first lockdown happened. I was a bit worried because the number of cases that I was getting was falling down. So I was just worried about future finances. And also I'm not very good at not being busy. So I need to constantly be doing something. And I learned that about myself in COVID. I mean, I kind of knew to a degree, but like my mood plummeted when I had nothing to do. And I had to find something. And eventually it was this podcast, and it was also working Frontline 19. But there was a 1 or 2 week period where I had very little to do. I was like, my kids are quite young, but I was like forcing them to study because I couldn't think of anything else to do. So my poor kids were getting like this really harsh DAS college, I called it, at home. And my wife convinced me that I was doing they only need an hour a day, but I was trying to do like 3 hours a day. And she had to like pull me off them and just take your energy somewhere else.
Oh no.
But it was hard at the beginning. I think like most people, it took a while to equilibrate until everything else caught up.
Yeah, it was like a sort of a bit of an anger, like for me as well, because I was thinking, God, I only started this job like a year and a half ago, and now like here I am. I just sort of thought, well, like a year ago, and I thought I didn't want to be a superhero, like everyone's calling me. I don't want to be walking into danger. Like, what the hell am I doing? Yeah. But obviously, you see your colleagues going through and doing it all and being brave, and you've just got to do it yourself, haven't you? So
do you feel better prepared for this second lockdown, do you think?
Yeah, definitely. We've actually got PPE now. We've actually, got like sort of systems in place. So yeah, I feel like it will be okay. Hopefully.
I suppose if your daughter's presumably going to school now throughout the second.
Yeah, she's 4. Yeah.
Okay, so I think that makes a big difference if your kids are sort of taken care of during the day, then it gives you a lot
Yeah,
more
like
freedom.
we're lucky because I worked through. She was still going to nursery and things as well. So that was good for her because her life wasn't changed either. So that was really good.
It's good to hear. When I was doing a little bit of research about you, I kept coming across this phrase, law of attraction.
Yeah.
I've never heard it before. Can you tell our viewers and myself a little bit about it, please?
It's just quite a new thing that I've sort of learned to do, really, the past couple of years or so. And it was my brother that started sending me these Will Smith clips of him talking about it. And it just helped me because of all that I've been through, I have had quite a negative outlook on life for a number of years now. And naturally, I'm a positive, bubbly person. And what the law of attraction helps you to do is, like, you know, instead of focusing on those negative things, if you go into, you know, a party and you're negative, you're going to look and see all these negative things happening, and then negative things are going to happen to you. Whereas if you're there and you're like, this party is going to be amazing, you're already happy and you're going to make other people feel amazing, and then the party is amazing. You know,
how do you get over it not meeting your expectations though, or are you saying that the law of attraction, it always will because of your way of thinking? So I suppose another way of asking that is, what happens if you go to the party expecting it to be good, but it's not as good as you?
Yeah, that has happened to me. What was it? I did something, I was like manifesting for ages and like literally weeks, and it didn't happen. And I remember phoning my brother and being like, it's crap, it doesn't work, I'm not doing it again, like it's ridiculous. And he was saying, yeah, but that's not the point. It's the point of your mindset was positive and you felt good about that. So even if something doesn't happen, you know, you've had a couple of weeks say you're manifesting that you're going to get that job. You know, the weeks leading up to that job interview, you haven't been sat there getting really nervous and anxious. You've been feeling positive about it and you've had confidence in yourself. Okay. You know, so it's sort of mindset more than anything. But yeah, I'm still definitely learning to do it better. For sure. But I think, yeah, it's important. Even if it doesn't work, like, just do it anyway because it's good for you. It's sort of like placebo, like pills.
Okay.
Like, just if you think it's all right, then it will be all right, won't it?
I'm a big fan of Will Smith's attitude. Actually, I like his acting. I like his personality, his attitude. Not a big fan of his rapping, but that's a whole other subject. But I've seen a couple of the videos. I don't think I've seen him use the word law of attraction, so I've maybe not seen the same ones as you, but I've seen a couple of random ones.
Yeah, like manifesting and things.
He's just got this just really positive attitude in everything that he does, and
yeah,
he doesn't make any decision unless it benefits him in the future. So I remember him talking about how he stopped drinking alcohol, I think, from a really young age, like in his early 20s, because he realized that it just is not something that will help him in his career. Hangovers or doing something impulsive potentially could ruin it. So he just made the decision not going to drink again and just hasn't since then. So yeah, there's a lot to be said, I think, about the power of mind. What about the elections? Has that impacted you or your mental health in any way, would you say?
I didn't think it would, to be honest, because obviously it's not my country, but I think America is just so connected to the UK in so many ways. And I have been like every 15 minutes, like trying to refresh, you know, my little Daily Mail app, at what's been going on. And it has made me quite anxious. You know, God knows what people are thinking in America. But no, it hasn't made me too anxious, but a little bit. Not anything that's affecting me negatively. What about you? Have you been keeping up with it?
It's funny you asked that, because I did another interview for this podcast with another guest who asked a similar question, and the answer is no, actually, because I think that I think it's quite easy to fall into the pattern of the trap of what you're just talking about. I think you can become too over involved, and I kind of thought, right, do I need to know today? Do I need to know like who wins the election or the aftermath of whatever Trump does? Do I need to know in the next hour? Do I need to know tonight? Do I need to know tomorrow? Do I need to know next week? And actually, it doesn't make a difference to me personally. I do want to know, but I'm also aware that I can detach myself from it all, and it's not going to change my life directly.
Yeah.
And once you appreciate that, it gives you a bit of power. You I guess what I'm saying is sometimes you're forced into caring about something, even though it doesn't really affect you. And I think because I've thought of it and not automatically gone with my natural instinct, I've managed to separate myself from it.
Yeah, that's a good point.
But you're right. It's like a global event, really, isn't it? Even though the States are so far away, that everything it does kind of impacts us. And yeah, it's just a crazy time, absolutely crazy time.
Yeah, who would have thought?
Do you have any advice for anybody who is getting over anxious, either about COVID or about the elections? You're obviously somebody who reflects on your own mental health and has ability to be introspective. Have you got any advice for anybody else?
I think the obvious one, obviously, just talk about how you feel, even if you are just feeling a little bit anxious today. Like, ring your mum or your friend and just say, oh, you know, I'm feeling a bit like this. Like, are you worried about this situation? So even just having a casual chat with your friend, it's like you just offload steam, even if they don't really give you any advice that's helpful. Sometimes talking and hearing your own voice say your thoughts, it sort of helps you. Same as like writing a journal or something. But definitely with anxiety and everything that's going on in the world, what's really helped me is meditation. Is something that over the last couple of years I've been really into, because it just makes you, you know, you're sat there in silence in your own thoughts, or you're listening to music, and it just, you're so in tune, like with your breathing, and, you know, you sort of, what I like to do is like vision myself like at the top of my house, while like looking down at myself, and then from the top of my street, and then from the top of the country, and then I'm in space. And it just sort of makes you realize how small you are in like the world and the universe, and your little problems aren't actually that.
And is that a technique you learned, you created yourself, or did somebody teach it to you?
I just thought of it myself one day, like a couple of years ago, and now that's just kind of what I do to like, because it does really, it's like if I climb a really big hill and I'm looking over at the town, it gives me that same feeling of like, no matter what's going on in my life, it's not really that big of a deal. So that definitely helped.
I think for me, meditation has always been something that I've not quite ever got round to trying, but I believe there must be something in it, because so many other people that I've spoken to have spoken about it. My parents are fairly religious, they're Hindus, so it's always been a big part of, even since I was a kid, meditate like for like a good half an hour to an hour every single day. So I've always seen it, but I've never really been convinced that it's for me. I think because, if I'm being honest, I don't want to shut my mind down, to slow down. I like being kind of frenetic.
Yeah, I think it is weird. The first couple of times you do it, you're like, what am I doing? But that one day when you actually feel like you're floating, it's like, oh my God, I get it. Like, it feels so nice and relaxing.
Then let me ask you this: does it have a lasting effect? Because I imagine, I have nothing to base this on, because I've never tried it properly, but I would have assumed that you only feel calm for those few minutes, whatever, 10 minutes, and then it's back to how you were before. So like, am I wrong? Is there a lasting effect, would you say?
Yeah, like not like a couple of days, but I definitely feel for the rest of the day, I won't snap at something really quickly like I usually would. It's like you sort of just reset your mind for that day, really. So it's quite nice to do it in the morning, because you've sort of reminded yourself to think that certain way, that your little life isn't really, you know, in the grand scheme of things, that important. You can get through it, you know, so it does stick with you, definitely. But for me anyway, it might not for anybody else. But
and you mentioned anxiety before. Do you mind if I ask, was that a general kind of sense of anxiety, or was it about any specific situation?
I think it started, I had a miscarriage before my daughter, and then when I was pregnant again, that's when it started. I've never ever been anxious before. I used to perform in front of like hundreds of people, and like I just never ever cared about that kind of thing. But yeah, I just started getting really anxious, thinking I'm not going to be able to carry this baby to term. I'd be obsessed with like going to scans and things like that, and trying to find the heartbeat. And I just think it definitely like stemmed from there. And then obviously when Ella was fine, it was like, what if I'm walking down the street and someone snatches her, or what if, you know, and then it spiraled into other things like social anxiety was the main thing. I literally didn't leave my house for so long, because I was just so scared of everything, thinking that people were going to judge me, and I'd say something and at like a gathering or whatever, and I'd go home and I'd think about it for days. I'd be like, people are probably thinking, what a weirdo, like why did she say that? That was like so weird. No one talked to her again, when in reality no one probably even heard what I said.
Yeah.
Just so blown out
And
of proportion.
everyone's sort of so tied up with their own insecurities, they don't actually really care that much what somebody else is.
Yeah, so that was a pretty thing. But
when you said you performed in front of others, that's singing, am I right?
Yeah, and acting. I used to be like in like musicals, did like performing arts college, film school, that kind of stuff when I was younger.
So it must be possibly even harder for somebody with your background to cope with social anxiety if at one point you were so outgoing and so comfortable with being in public, to go from being used to that for many years to go to suffering social anxiety. It's probably harder than the average person.
Yeah, I'd never really thought about that, to be honest, until you just said, but it was, because it was like, I just didn't feel like myself. It was, you know, one of the, I think like in the top 3 fears in life is like public speaking and stuff. Like I genuinely didn't care. I could talk to anybody, like whatever. And so, yeah, not being able to talk to anybody without fear or, you know, being anxious about every single little thing in life, it was hard, because I'd be in bed thinking, who is this person? I put on a lot of weight as well with Ella, so that was even more, because I'd look and I wouldn't recognise her mentally and I wouldn't recognise her physically either. It was just a really hard time.
Yeah, absolutely. And what about recently, say in the last couple of months, how's your mental health been overall?
Yeah, quite good. Once I'd done therapy, I had about 6 or 7 sessions with that lady. And I actually had the confidence after that to come off my medication. So I've been off that for about 2 years. So sometimes I go through like little lows and I'm snapping at my fiance quite a lot and I'm really impatient with my daughter and I'll be sat there crying and I'm having a really hard time. And because I don't have that medication to sort of like even myself out, I really have to try and do it by myself with that just mental strength. So that obviously takes a little bit of time. So sometimes I will be in a down pit for a couple of days. But overall, like really, really good.
Good.
Yeah, really good. I'm just so proud of where I've come from. And that's why I want to do this, because I think if I can do that from being suicidal and self-harming and to actually now respecting myself, respecting my boundaries, not letting anybody come into my life who's going to be a negative impact. I want to tell people that they can get there as well. Yeah.
And that's what you're doing through your podcast, really.
Yeah.
So the psychiatrist in me can't hear the term medication without asking what meds were you on?
Fluoxetine.
Okay, so that's a very common antidepressant, Prozac it's called in the States. Did you find any side effects with it?
I didn't actually. I mean, well, not that I know of. It was the first one they put me on. I think they put me on like a higher dose eventually, and then when I was weaning off, I got put on a lower, and then I'd take one every other day rather than every day, and then sort of wean myself like that. But I never had any problems with it. I think it might have started to, I don't know if this is the case, but it started to maybe like not work eventually, because I was on it for quite a few years. And I didn't feel like it was really helping me anymore. And I think that's why I went to therapy, because I thought, you know, if this actually helps me, I can come off the medication and not need it. So I don't know whether, does it like stop working after a few years?
So it's really variable. Some people try any antidepressant, but fluoxetine is probably one of the most common ones. And sometimes it helps immediately. Sometimes it doesn't help at all. Sometimes people get horrible side effects. Usually, if it's going to work, it usually starts to work within around 4 to 6 weeks. And some people get what you're talking about, which is tolerance. So from my experience, I'd say probably about a quarter to a half of people eventually get tolerance. I think to a degree it's unpredictable, but I also think it's also about other things that are going on in your life. So if your social situation is roughly staying the same over 6 months, a year, 2 years, then the fluoxetine is going to carry on being effective. But if other things outside in your life are getting harder, you're getting through more social stresses, then you're going to need a little bit more medication. But because your medication dose is staying the same, the effect of it kind of decreases and builds. So my final question to you, Jodie, would be this whole experience, everything you talked about, from your mental health issues to your therapy to your podcast that you've done. Is there any kind of lesson that you've learned that wasn't expected, or anything that you've experienced that you wouldn't have expected at the beginning?
I definitely think that, you know, when I was starting to be open about everything and doing this podcast, I didn't think there would be so much sort of support. Like I posted about for example, like my skin picking disorder, like of my hand, and just kind of explained like what that was and wanted to sort of raise awareness for that, because it's not really spoken about a lot. And I only literally, my parents and my fiance know that I have this. And I had so many nice comments about it and support, and I was so nervous posting it. And that's what I've learned, that actually there are so many more people that will be supportive and help you than there will be saying, "Ew, like why are you talking about that?" And it does make me frustrated when I see people upset, because I think if you just talk, you know, there are so many people that will support you than what you realise. And yeah, that's definitely what I've learned. There is a support out there and people are really nice.
Okay. Do you get negative comments?
No. I'm sure, you know, as it grows, I will. But I've got a strong enough skin now through everything that it won't bother me. But yeah.
It's a very good attitude, because a lot of people are very sensitive. Some people focus more on the negatives than they do the positives, I guess. But it sounds like you've got a sensible handle on things.
Yeah, I think being bullied for all those years, I'm like, anyone can say I've had the worst things said to me. Like it doesn't matter anymore.
Does it kind of toughen you up to a degree?
Yeah, definitely. And I think that's why why it surprised me, learning that lesson that everyone's nice, but not everyone. Most people are nice, because I'd started to think that I hated people.
Yeah.
Didn't like having new friends because they would just do, you know, something behind my back, or, you know, I had such a negative view of people. Yeah. But during the pandemic as well, I've just been so heartwarmed by how nice people can be, and doing the podcast. So that's really, really nice.
Great. Can you plug your podcast, please, for our listeners who might be interested?
Yeah. So it's the Mental Health Podcast. You can find it on Spotify and all other places where you listen to your podcast. My Instagram is the Mental Health Podcast, with a dot in between each word. So yeah, go give me a follow and see what other guests have got to say on my podcast, for sure.